This is a screenings video done by Kylie Forden and Delaney Lane. The objectives of this video are to discuss topographical disorientation screening, learn how to screen for topographical disorientation, discuss facial nerve screening, and learn how to screen for facial nerve damage. Topographical disorientation is the inability to navigate through an area. It involves difficulty comprehending the relationship of one location to another. Some common diagnoses seen with topographical disorientation are stroke, traumatic brain injury, and dementia and Alzheimer's. It is common to see topographical disorientation with both stroke and traumatic brain injury. After someone has an injury of this type, there are many different deficits that can present. Confusion is very common. Sometimes this confusion wears off in a few days, and sometimes it's permanent. Either way, screening for topographical disorientation needs to be done. Since dementia and Alzheimer's is a degenerative disease, many other symptoms will be seen before losing one's place. Based on the functional assessment staging test of Alzheimer's, it's usually around stage 5 when they become confused about where they are. At this point, it's common for people to use signs to remind them how to get to familiar places. There are many different ways to screen for topographical disorientation. One way is to have the patient find his or her way from one room to another. This is just done by giving verbal cues whenever they need. Another way is to give the patient written directions and have them follow those directions to a new location. These written directions can be very specific, telling them to turn right and to turn left, or they can be vague, having them recognize landmarks they pass along the way. Either one of these are acceptable, it just depends on their level of function. The third way to screen for topographical disorientation is to draw a map and have the patient find their way to the new location. In the video demonstrating the screening, we use the first way. I pose as the therapist, while my partner poses as the client. I then give her verbal directions to find her way from the water fountains to our classroom and follow her as she makes her way. Whenever she starts to get lost, I'm able to give verbal cues whenever I think that she needs them. Here is the video demonstrating how to screen for topographical disorientation.
Okay, so we're going to demonstrate how to screen for topographical disorientation. I'm going to be the therapist and Kylie's going to be the patient. We are at the water fountains that everyone knows so well, and Kylie's task is going to be finding her way back to the classroom. I'm going to give her the directions and then verbal cue her if she needs help finding her way back. So, Kylie, your task is to find your way back to our classroom. Okay. Let me know if you need any help. When you're screening for your patients, you need to watch for continued disorientation, and then if they start asking for help, just be more vague with your verbal cues to begin with, and then become more specific with the more help that they need. I don't remember where to go. Does this hallway look familiar? Do you remember passing those benches before? Yes, that's correct. Good job. Hey, you remember that table? We're getting pretty close. This looks familiar. I think you're right. And we have made it back to the room.
Topographical disorientation is indicated if the patient commonly becomes lost while trying to navigate around this treatment setting using verbal directions. In the video, we see that Kylie had one wrong turn, but with just a little bit of verbal direction was able to find her way all the way back to the classroom. If I was a therapist doing the screening, I might have her do it one more time just to make sure, but I would say that her topographical orientation is intact.
The facial nerve is cranial nerve 7 and innervates both sensory and motor portions of the face. The sensory portion of the facial nerve innervates taste for the anterior 2/3 of the tongue. The motor portion innervates the muscles of the facial expression and muscles used for closing the eyelid. When doing a facial nerve screening, the sensory and motor functions are both tested. When screening the sensory function, sweet, salty, and sour solutions are used to test if the patient can taste anything, and if they can taste, if they can distinguish between the different tastes. The solution is applied to the anterior lateral part of the tongue, starting on the uninvolved side first. The patient has an impairment if they cannot detect taste on one or both sides of the tongue. Here is a video demonstrating a sensory screening for the facial nerve.
So we're going to demonstrate how to screen the sensory portion of the facial nerve. So what we're going to be doing is seeing if the patient can taste what I'm putting on her tongue and if she can tell if it's sweet or salty. So we're going to have her be seated and she's going to close her eyes. And I'm going to do the uninvolved side first. So have the patient stick their tongue out. I'm going to do the uninvolved side and have her tell me, do you taste anything?
Yes,
Sweet or salty?
sweet.
Okay. And we're going to do that again. Do the uninvolved side. Do you taste anything?
Yes,
Sweet or salty?
salty.
Okay. And then we're going to move to the involved side. We're going to do that again. Do you taste anything?
Yes,
Sweet or salty?
sweet.
Okay. And then we're going to do one more. Sweet or salty?
Salty.
Okay. Good job.
Video, the patient would have no sensory facial nerve impairment. When screening the motor function of the facial nerve, the strength and symmetry of the facial muscles are being assessed. The patient can either have an upper motor neuron lesion or a lower motor neuron lesion. Both of these lesions affect the lower facial region, but the lower motor neuron lesion affects the eyebrows and forehead as well. Check for asymmetry while the patient raises their eyebrows, smiles, frowns, puckers their lips, and holds air in their cheeks. The patient is impaired if an asymmetry is observed on the affected side while doing these expressions. Facial nerve screening is usually used for stroke patients and patients with Bell's palsy because nerve damage is common in both of these diagnoses. The following is a video demonstrating motor screening for the facial nerve.
So now we're testing the motor portion of the facial nerve. So I'm going to be looking at the strength and symmetry of the patient's facial muscles. So I'm going to have the patient see if they can raise their eyebrows. Good. And now smile. Good. Can you frown? Good. And then put air in your cheeks. And don't let me push it out. Good job. So we're just looking to see if the right and left side of the patient's face are symmetrical. And then when pushing on the cheeks if the strength in both cheeks is the same.
This was a demonstration of a patient with no facial nerve impairment. In conclusion, both topographical disorientation and facial nerve impairment can be tested by an occupational therapist in these ways.